you ever noticed a mole on your body where you think, that looks a bit odd? Maybe I should get it checked out, but then you never got around to it? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with you the top 5 signs that a mole on your body could be suspicious and precancerous or even skin cancer itself. So you might be wondering, why is a physiotherapist talking about skin cancer and moles? Well, simply because as physiotherapists, we're often treating back pains, neck pains, arms and legs, and we see people's skin and where moles are, where people can't see themselves. And here at My Favourite Physio, we're always mindful of our patients' general well-being. That includes, if we see a suspicious looking mold, we would highlight that to our patient because they may not have noticed it or can't see it because it's an awkward position in their back where they can't see easily. And recently, it's happened with a few of our patients where we're treating their back and neck pain, where we notice abnormal looking moles and highlighted it to them. One lady in particular, when we were treating her back, the mole was actually bleeding, and I said to her, this isn't normal. You need to have a look at this. Get your GP to have a look, and you probably should go see a skin specialist to just get your skin checked for any suspicious looking moles or skin cancer. This lady actually followed through on what we said, went to her GP, who said, yes, that's an odd looking one, we should remove it. And her GP was able to do so and send it off for a biopsy, which came back as pre-cancerous. So she was really grateful that we raised the topic about abnormal moles and brought her attention to it, and she acted on it quickly to prevent it from becoming something more sinister. So I thought I would just jump in and share with you. So if you were noticing some moles on your own body, or perhaps your loved ones or your partners, to be able to go, oh, hold on, is that an odd looking mole? Perhaps we should have it checked out properly by the GP or by skin specialist. So the top 5 signs you should be looking out for suspicious looking moles that may end up being cancerous or precancerous is as easy as ABCDE. A for asymmetry. So if you look at a mole on your skin and you imagine that that mole could be divided into half, it should be completely symmetrical. So moles that are normal and not a problem are ones that look symmetrical. If it looks asymmetrical, meaning if you cut it into half and one half looks a bit bigger or jagged and the other half smaller, then it's asymmetrical and it could be a concern, and you should have it checked out by your family doctor or a skin specialist. The second point is B. B is for border. So the border of a mole that is normal and healthy should be even and nice. Now, if the borders look a bit blurred or it feels and looks bumpy to touch, then it could be a concern. So if you look at a mole on your skin and it looks bumpy or it looks uneven in its borders, please get your GP to have a look at it. The third point is C, color. Now, if it's an even color, it's fine, but if you see that the mole has different colors within that area that it is, and some moles are really, really small, tiny pinpoint, but yet you can see there's some discoloration or uneven coloring through it, then it is of concern. Again, go to your GP, highlight it to them, get them to have a look. The fourth point is D. D stands for diameter. So if you look at the diameter of a mole and it's greater than 6 millimeters. So if you notice a mole that was really small and over time it seems to have grown bigger and bigger, if it gets to bigger than 6 millimeters in diameter, then it is a concern and you need to see your GP about it. Last point, number 5, E for evolving. If you've noticed that the mole is evolving and over time not only got bigger, it got a little bit more uneven, or if it's bleeding or it starts to change, then it is of a concern and you really need to go see your GP about it. So if you are aware that there's some moles that you've been aware about on your body and you've kind of been wondering about it, take this as a sign to have a look and follow the top 5 signs of ABCDE. If you find anything suspicious, please contact your family doctor right away. Make an appointment, go in to see them. Prevention is always better than cure, and skin cancers can be prevented quite easily if you just have regular skin checks. And for those of you who might always be in the sun, make sure you put on sun protection. Sunscreen is essential. If you are concerned about any back pain or neck pains and you want to see a physio who is always going to be holistic about your whole care, you can ring us here at My Favorite Physio, speak to one of our expert physiotherapists. The number to ring is 02-9790-4233. And if you know somebody out there in your world who you care about and who's always out in the sun, why don't you like and share this video with them? Until next time, have a fabulous day. Bye.